All right, good morning. Thank you so much for your patience, everyone. We're going to get started. Good morning, good morning, good morning on this beautiful March 22nd morning. Thank you for being with us. Everyone, thank you for joining us in this virtual space for another York College Executive Leadership Breakfast. I'm Berenecea Eanes, President of York College. And on behalf of the 8,500 students or more and the 200 faculty members and the dedicated adjuncts and staff, I want to thank you and welcome Lieutenant Governor Kathy Hochul as our keynote speaker this morning. We wanted to invite the Lieutenant Governor this Women's History Month. She is the only of 3 women who have served as the Lieutenant Governor of New York and will be the speaker this Women's History Month. Thank you, thank you, thank you for being here. I also want to extend thanks to the Queens Daily Eagle for once again being our co-sponsor of this event, and to Alex De La Campa, Division Supervisor, Queens FEMA region, and otherwise known York College vaccination site. Our vaccination site has been very successful, and we just recently reached 75,000. We'll talk about that a little bit later. York College Foundation members are joining us, elected community, and others very important to us. So thank you to our elected officials, our foundation board, our students, our staff and faculty for being here. Let me also say how much it has been wonderful, and we're enjoying serving the community and other colleges with our mega vaccination site. This vaccination site is specifically for our area, and it's very important. It is our service to the community. I'm very thankful for the community for taking full advantage of the opportunity, and we have again vaccinated nearly 75,000 since we opened on February 24th. Congratulations to our counterpart, Medgar Evers College, whose numbers are also impressive. I want to thank Chancellor Matos Rodriguez for his support of these efforts. And without further delay, please join me in welcoming the 77th Lieutenant Governor of New York, Lieutenant Governor Kathy Hochul, who is a great asset to our community and a wonderful leader. Thank you.
Well, thank you, President Johnson-Eanes. And first of all, thank you for hosting this life-saving vaccination site. I mean, to make it easier for people in the neighborhood, people throughout Queens to be able to come in and walk out the door, because I've been to many of these sites, walk out with that sense of just relief that they finally have taken the steps they need to survive this pandemic, because it has been brutal. I don't need to take a flashback down that long, dark road that we just came through over the past year, particularly in places like Queens, which were so hard hit. And I think that we are always going to be so grateful for the individuals who stepped forward, the first responders, the doctors and nurses who showed courage, literally like firefighters running into burning buildings in the early days of the pandemic, when they did so at risk to their own health and the health of their families, and the countless people who kept showing up. Our teachers and students having to show up, not just to learn virtually, but also to go to their jobs. And many of them are out there with the public, packaging up food for delivery services and driving buses and countless ways. And I think there's one takeaway, and I want this to be a permanent takeaway from this pandemic, is a greater appreciation for each other and the roles we play. You may not have always appreciated the grocery store worker and the people selling you toilet paper during a pandemic, but my gosh, I think we all felt this sense of relief that we're going to be okay as each one of these individuals did their jobs. And I think that's an important lesson for all of us, that we talk about executive leadership. Leadership has countless faces, countless faces. You don't all of a sudden become a leader because you're elected or you run a great institution like York College or you're on the SUNY trustees. Yes, those are automatic and they've conferred a title to you where you can lead. But look at our community and the different ways that people have led through their own courage and willing to step up for each other. That to me is the real hallmark of a leader. And I want to make sure that we take some lessons from this experience. And again, we all know what we went through, but there are things that are going to be positive takeaways. I think real leadership calls upon all of us to say, yes, it was brutal. It's a hopefully once in a century experience that we'll never see again. But what have we learned from this? How has it made us stronger? How has it built our own character? How has it prepared us for life's adversity? And I've spoken to countless college students, including nieces and nephews in my own family. And as much as they'll say, Aunt Kathy, I didn't have any friends, I'm a freshman and there's no one, I don't know anybody, and it's been lonely sitting in my dorm room by myself trying to learn. I say, you know what, sweetheart? This is going to build your character and make you stronger. So no matter what life throws at you, you'll always be able to harken back to that time, that year of 2020 and 2021, when you survived a pandemic. And I want everybody to wear t-shirts. I survived the pandemic, because that has built a strength in you that you don't know you have yet, but you did it. And that's something I want all of our students to recognize, that this has strengthened you. It's like molding steel. You're harder now, and you're going to be able to handle what comes your way, no matter what it is, because you can say, I did this. And so that's a strength we should look to in each other and find ways to celebrate. But also, how have our lives changed, perhaps permanently? Perhaps be able to work from home and to be able to be educated from home and to have more opportunities with education for people around the world where that was inaccessible to them, or healthcare. Think about the fact that we now can sit at home looking at our iPads or our computers and get treated by a doctor for an illness, because there's so many parts of our country, particularly in our urban areas, that are healthcare deserts. It's not easy to get healthcare. A lot of people still don't have insurance, but they can go to a doctor and see a practitioner, or if you have substance abuse challenges, talk to someone who can give you advice and medication-assisted treatment, talk to a mental health therapist. So I think that we can become a healthier people, a stronger people, because we now have more access to healthcare services that were not there before, when insurance companies didn't cover them. Also, what does this do for women in the workplace? It is Women's History Month. And if you don't know the history of our long march toward equality in the state, you need to get a refresher on it. And look at places like Seneca Falls, where in 1848, 300 women, mostly women, traveled there, but a few great leaders. If you know the name Frederick Douglass, and if you don't, you need to know Frederick Douglass. He actually stood up when women were debating whether or not we should even ask for the most audacious thing. Should women even have the right to vote? I mean, that's really out there, they thought. And Frederick Douglass stood up, the most eloquent speaker of his time, and said, yes, women should have this right. Now, it took another 70 years, and these women were abused in their communities, their churches, their families. They were ostracized. Sometimes they were beaten, sometimes they were arrested. But you know what? They never gave up the long journey, even though they never got to see it get over the finish line, because it did take 70 years for that right to vote. So that's in our DNA, and the long march forward. People like Shirley Chisholm, a great hero of mine. I've had a chance to work with her and know her when I was a young staffer on Capitol Hill. And people like Geraldine Ferraro from Queens, the first woman to be vice presidential candidate, who was the predecessor to our fabulous Vice President Kamala Harris, and how proud we are of her and what she's doing. So I look to the women, particularly of this state, and say, you know what? Life can be tough sometimes, but look whose shoulders we're standing on. And they've passed us this torch, and those battles are not over. This week, we're honoring Women's Equality Day, which establishes the fact, and it is not a fact I'm proud of, that women still don't earn what men earn in this day and age. They still are short money at the end of the day with their paycheck, in terms of how men are compared, particularly women of color. Women of color have to wait till August in order to earn what a white man earns at the end of December. So these are disparities, these are inequalities that still exist. And also the burden of childcare. My gosh, any one of you students who have kids at home while you're trying to learn remotely, and your own children might be having to learn math, multiplication tables at the kitchen table. How maddening has this been? But women are so strong. And I want this to also be a takeaway from this pandemic. We talk about leadership lessons, how all of us in every position we have will look and say, women were the front line tip of the spear in this battle. They went into the healthcare jobs. 75% of the healthcare jobs are held by women. They showed up at their minimum wage jobs to keep working. 3/4 of minimum wage jobs held by women, a majority of them held by women with children. So these are struggles that still exist today that did not get easier because of this pandemic. But let us leave this experience recommitted to honoring women's history, but not just talk about it in the past tense. Let's talk about 100 years from now. Let's fast forward 100 years. And what will the people say when we honor the 200th anniversary of women winning the right to vote, or Women's History Month in the future? What will they say about the people of our time? What have we done to make a difference to further equal justice for all, but particularly relieve some of the burden that's placed on our mothers and our parents? Let's figure out how we can change that dynamic and make a positive story that people will celebrate the names of the people of today, just as we're honoring those women of the past. So that's what I'm putting on all your shoulders. And I want to talk about one more thing in terms of a takeaway from this crisis. We have learned the critical value of crisis communication. Crisis communication, you saw it on display when Governor Cuomo did his daily press conferences. He calmed an anxious nation, particularly when the president of the United States was giving contrary messages and alarming people, and then also saying it doesn't matter, and all the frustration people felt. They just needed to listen to one person and take that message. My responsibility for the past year has been to amplify that message, doing over nearly 600 press interviews in every corner of the state to try and explain to people, meet people where they are, go to their social media platforms, go to their media that they watch on the newspapers they read, or the television they watch, or the radios they listen to, and just talk to people about their anxiety and their concerns and validate that and let them know we understand that. And I think that's what leadership needs to be. Leadership needs to be empathetic. You need to reach out to people and understand their station in life, their biggest concerns, and how people in leadership need to address them. So I believe in compassionate leadership, leadership that treats everyone with respect and as humans and has value. Their opinions have value. So crisis communication is important, empathy is important, as well as collaboration. Look at the collaboration that's going on even at your gym to this day when people are receiving that vaccine. That's the federal government, that's the state government, that's our local academic partners like your college, all pulling together, all united in a common cause to get more people vaccinated so they can have that comfort of knowing they're going to be okay. So those are some of the takeaways that I've seen during this pandemic, the leadership opportunities that have been there, and shame on us if we don't learn from them and instill those in who we are, but also how we can solve the future problems based on what we now know, recognizing the childcare problems for women, more workers who are going to be displaced, people who thought they had a job working in hospitality in a restaurant, maybe they worked in theater, and those jobs may not come back anytime soon. How we get them a good education at places like your college, how we get them job training skills, how we send them onto a path where they're going to have a long-term sustainable career instead of a short-term job. And that's what we're going to refocus our energy on. Childcare for women, making sure there's job retraining for individuals, making sure we continue investing in projects that'll bring money to an area, infrastructure, and other opportunities for supporting businesses, support for our local mom and pop businesses. And if you get any stimulus checks, my friends, get out there and spend it in your local community. I helped my mom start a small business. Boy, did they struggle during this pandemic. It was brutal. Flower shops. Nobody was buying any flowers for graduations and weddings and funerals, and they were just devastated. And that's just one tiny example of the people that we want to make sure survive. So get out there and support your local community. And lastly, to better yourself and develop your leadership skills. Lean hard into developing your opportunities for public speaking and things that scare people by nature. But we need communicators. We need people who are not just good writers communicating in the print, but also people who are comfortable in front of an audience. And I developed this skill as a student in college. I was a student leader challenging apartheid in South Africa, getting our university to divest its holdings in companies doing business in South Africa back when Nelson Mandela was calling America to exercise its political clout to change the system of apartheid. And I joined that effort, and it called on me as a teenager to stand up before large groups and to speak. And I was terrified, absolutely terrified. But I didn't realize at the time that by putting myself in what I considered a stressful, risky situation, high risk for failure, that I was making myself stronger in that moment. And those are skills that still are with me today. I want every one of you to find those opportunities to speak out on behalf of something you are passionate about, some cause that you believe in. And there is no reason why every single individual who graduates from a great institution like your college cannot be viewed as a leader in whether it's in not-for-profits, whether it's in your own workplace, whether it's in your family, whether it's elective office. There are so many opportunities. We are begging for the next generation to step up, show us what you got, lean into it, and there is no age barrier. I've been working for candidates since I was 16 years old. And so there's no excuses, young people, no excuses. Your time is now. We need you to step up and help build back a better New York in this post-pandemic era. So I just want to thank you for this opportunity to say hello. You inspire me by just still showing up, fighting for your education, believing in the value of it, and to be at a great place. And President, I want to thank you again. Your leadership has echoed throughout our community, and we look to people like you to help us carry through our mission to make New York even stronger in the aftermath. So thank you.
Thank you so much for being here. I know that you have to move on to another meeting. We appreciate your message about resilience and patience and character building and grace. And we appreciate everything that you're doing. And we hope you stay healthy and safe. And remember that you're always with your family at York College. Thank you so much.
Thank you very much. Really appreciate that.
See you again.
Bye-bye.
Bye. All right, we'll move on this morning to our next conversation, which will be focused on highlighting the work of our vaccine center. I want to illuminate that we have Alex De La Campa, Division Supervisor, Queens FEMA Region 2, otherwise known as our York College vaccination site. His colleague, Trevor John Ritland, York College COVID Community Vaccination Center, DOD, T10 Commander, is also with us. And we are going to also, we've also been joined with several electeds, including and especially our Senator Comrie. Thank you for being with us here. So we're going to talk a little bit about what's been going on at our vaccination site and highlight some of the work. I know that I'm asking those who are helping with me with technology to unmute the appropriate people. So I'm going to ask that they do that now. I think we have a couple of guests here. We're going to talk about our vaccination site and how it's been going. So just give us a couple of minutes and we'll do that. And thank you for being here to celebrate and to hear Lieutenant Governor. So I think we're good. This is the Zoom life that we're living. So thank you for your patience. And be sure. I have the questions that we're gonna be there. We go, hello, hi.
Good morning. Good morning.
Good morning. Good morning. I don't know if anybody else will be added to this part, but we'll work on that. But what we want to talk about a little bit, and Alex, is, you know, what did it take to have a vaccination site? There we go. Hi, Commander. How are you? Good, 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 good. So I want to talk a little bit about, for the community, what did it take to have a vaccination site that's so high impact and was taking care of almost 3,000 people a day? Your insights on the operations, and then I have seen a lot of the responses from the communities because I visit, and so I'm overwhelmed by the energy and the organization. So if you want to, I'd like to hand it over to each of you. Alex, we'll start with you, right? And then Commander will come to you. Is that okay? And just talk a little bit about your experience. Thank you.
Good morning, everyone. I want to thank President Eanes for inviting FEMA to this executive leadership breakfast. Also, I would like to thank Ms. Dana Trimboli, Mr. Earl Simmons, Mr. Claudio Lindo for all the support provided to this operation. Since day one, they have been here providing us the necessary tools to serve the community. Also, I'm honored to hear today's keynote speaker, Lieutenant Governor Kathy Hochul. But before I continue, I would like to introduce our FEMA Region 2 Acting Deputy Regional Administrator, Ms. Dale McShine, first address the group on behalf of FEMA. I don't know if she has been able to connect.
I'll ask Claudio to keep looking for her. Alex, I'm sorry. It's a Zoom world. Do you want to go ahead, Alex, a little bit, and they keep looking for her? Is that okay?
Okay. So
thank you. Thank you.
Okay, in alignment with President Biden's national plan to respond to COVID-19, FEMA is working across federal agencies, state, tribal, and territorial authorities and private sector partners to assist, augment, and expedite equitable vaccination in the United States. FEMA, the state of New York, and local officials have partnered in establishing community vaccination centers to serve as the nationwide model for the equitable distribution of vaccine implementation. The goal of establishing these federal pilot centers is to continue to expand the rate of vaccinations in an efficient and effective manner, with an explicit focus on communities with a high risk of COVID-19 exposure and infection. The CVC locations in New York were chosen because they have some of the most diverse socioeconomically challenged communities in the country and have deep roots to reach those most in need of the services offered. We use data from CDC Social Vulnerability Index and work with our state partners to identify these locations. So one of these community vaccination centers, CVC, is established here in Queens at York College. Since day one, we as a team started with the preparation, planning, and logistics of this facility to support the administration of up to 3,000 vaccinations per day. On February 24th, we opened the doors and received more than 2,000 people. And as of today, we had administered more than 75,000 shots in arms to New York residents. Nevertheless, none of this would be possible if it wasn't for the joint effort of state, federal personnel, and the support of York College. With a workforce of nearly 200 employees from FEMA, engineers, Coast Guard, and other agencies, we work every day with passion, energy, and determination to serve this community. Even though the center is open from 8 a.m. to 8 p.m. to the public, our teams arrive as early as 5:30 in the morning to prepare the vaccine and make sure everything is in place to receive the public. With shifts of 14 hours a day, 7 days a week, our team continues with an excellent job highlighting our commitment with this community, working hard to make sure that most of the residents can receive the vaccine. During this time, the last 4 weeks, we have received different VIP visits, such as Governor Cuomo, FEMA Administrator Fenton, among others. All visitors refer to our vaccination center as best practice nationwide. Have asked that we share our lessons learned and practices with the rest of the COVID vaccination centers across the nation. This is the result of the effort and collaboration of FEMA member of this team, of every member of this team. FEMA is using our site as an example to help improve vaccination operations at sites across the country. And my last comment. In my 32 years with FEMA, I've worked over 80, 90 presidential disaster declarations across the nation, but this is the most rewarding job experience that I ever had. We're saving lives, and we're serving some of the most diverse socioeconomic challenged communities. We're vaccinated, as indicated earlier, 3,000 persons per day. And they all leave our vaccination center very thankful and relieved. They feel like we're saving their lives, and that is why this mission is so valuable and meaningful in people's life. To end, I would like to share a letter we received yesterday from a gentleman from Queens community. I'm gonna read it. His name is Mark. I have it here. That's the letter that he sent to us and leave with one of the vaccinators in the pods. To FEMA and Navy, after my second shot, I just want to say that everyone at your college has done an excellent job. I appreciate the fast, efficient, and friendly way the staff has handled themselves. As a resident of South Jamaica, I'm not used to receiving such excellent service. So thanks everyone for their excellent service. So with that said, there's not much that I can say. Again, thank you to your college for hosting us, for supporting our operations, and we'll be always be ready to answer any questions.
Alex, thank you so much. Thank you so much. Could you remind me of the name of your colleague, and then we're going to go to Commander Ritland. You were waiting for a colleague to come on. I want to be sure I don't miss
Yeah.
that person.
Miss Del McShine.
Okay, I'll have them look for her in the Zoom, and then
Okay.
we'll go to Commander Ritland now. And if she's here, we'll bring her on so she can say hello. Okay?
Thank you.
Thank you, Commander. You ready? And thank you everybody for your patience because they're busy operating the site while they're doing this also. So I looks like you're still muted. I'm going to ask my tech people whether they need to unmute you. There we go. You're unmuted.
Hi, good morning.
Morning.
Thank you, President Eanes, for inviting me as well. This very important executive breakfast. It's an absolute pleasure and honor to be here. And I just say that, it has been, so when I reflect back to when we got the call to support this mission, a lot of us had less than a week to plan and prepare for it. And so a lot of us, to include myself, did not have much experience when it comes to supporting a vaccination center. My background is actually diving and salvage. So Navy diving and salvage. And we have a large group of people who are not on the medical side, but when we came up here, I tell you what, just like Mr. Della Campa said, is that this has been so rewarding and so such a great experience that we're able to help the people of New York, to help the citizens of Queens. And what I love about this experience is the fact that it's been so much a team effort. It's a team effort. It's a rewarding effort. It's humbling. It's exciting. When you see the patients come into the facility and you see tears in their eyes, sharing their stories about the fact that some of them have not left their homes more than 5 times over the past year, the fact that they're seeing a light at the end of the tunnel, they're seeing hope that that the light at the end of the end of the pandemic is, maybe it's not, tomorrow, maybe it's not over the next month, but it's coming with everything that we're doing as far as putting people, getting people vaccinated and trying to find some sort of means to getting back to that normalcy that we used to experience before the pandemic. And people are eager to get back to that point. When we first got here, so every day here at York College, we talk about the number of COVID cases in New York, the number of hospitalizations, and the number of deaths. And just in the 5 weeks that we've been here, every single day we've been paying attention to it, and those numbers continue to decline. And so it's exciting to feel that we're making an impact to be a part of the decline, that we're making New York a safer place, Queens a safer place, and we're making it better for the nation. So it has been so rewarding, so exciting to be a part of this mission. We've got a great team working with FEMA, with the city of Queens, working with the state of New York, and everybody has been on board with what is needed to execute and support this mission. My military folks who support this cause, Mr. Della Campa had said, that they're long hours, but the guys aren't burnt out, and the guys are eager and excited to do it each and every day, and they come to work with a smile on their face, and they're happy to support this mission, and as am I. I'm glad that we're here, and I hope that we're making a difference to the Queens and the state of New York area. But it's been very exciting and very rewarding, and I'm glad that we're able to support the mission. So thanks you again for having me a part of this executive breakfast. It's an absolute pleasure, and as long as the state of New York needs us, we'll be here.
All right, so thank you so much. Thank you so much. We're just so happy. I want to mention that we're so glad that Senator Leroy Comrie was with us. He has to go on to another meeting, but I want to acknowledge that we didn't get to get him to make comments, but he was here, and we're very excited. So we're going to go on. And Commander, let me say that what I learned from being in the vaccine center is that the officers that have come to us from all over, they are so gracious. And I think also our community is just really responding to the talent of these amazing people, and that they're just so caring and many of them have never been to New York. So I have great conversations. I go and talk to people about where they're from and have you ever been to New York and how are you doing? And it has been quite an amazing process. Remember, I'm a college president, so I can't help myself. They always want to know why is this lady asking all these questions? I can't help myself. I'm just so happy to see them, you know, as young professionals growing and traveling and just doing their work in that way. So thank you for bringing them to us. Thank you so much. All right, I'm sorry, Ms. Dale, you're with us now. I'm gonna ask them to unmute you so you can say hello to everybody and talk a little bit about your, there you go, you're ready.
Sure. Good morning, everyone. I think this is, thank you very much, President Eanes. I think this is such a timely event this morning because it's the beginning of spring, which sort of brings in new birth and rebirth. And this is exactly what's happening in New York. I wanted to, like Alex, I wanted to really thank you and your executive leadership for being an integral part of the success of this community vaccination site. I think like Commander Ritland and Alex has said, this was an unprecedented mission and we all sort of pulled, you know, rolled our sleeves up and dug in to serve a community that we knew had a deep need. I think the partnership between York, the state, the DOD team has been unprecedented to the extent where a lot of the practices at York have now been shared nationally as best practices. So we can only get better and better. We have hit the 75,000 vaccination mark, and that's all because of the partnership and your engagement in your community and helping us to sort of bring the people to the door. So just wanted to end by recognizing Alex's outstanding leadership. He is the man for the job. He has really embraced the mission. His spirit, you know, he has worked with the community and he has delivered results. So I really want to thank on behalf of FEMA Region 2 and all of FEMA, I really want to thank Alex for this great work. And on that note, I'll pause, and if there are any questions, I'm happy to take them. Thank you.
Great, so we've turned on the chat, and so we're gonna ask people to ask questions. Commander, maybe you can, since we've enabled the chat, I heard that most of our officers came from Maryland and Virginia, but I'm not sure if that's actually true. So you don't have to, if you wanna put it in the chat, that's fine. Anything, people would love to know, I think, but I may be wrong. Am I wrong?
Yeah, and I meant to start off with that. So all of us are coming from the East Coast. So a good preponderance of us on the medical side are coming from DC, Washington, DC, and then on the non-medical side. So the team is comprised of 10 different organizations or commands. And, you know, on the medical side, so there's medical folks who are here and non-medical folks who are here. And on the medical side, the vast majority are coming from Washington, DC. And on the non-medical side, the vast majority are coming from Norfolk, Virginia. So the Norfolk, Virginia area. But there's a smattering of personnel from basically all up and down the East Coast. And so that's where we're all coming from. And we're coming from operational commands, and we're up here to support the mission is in support of FEMA. So yep, it was drivable. So it was about a 7-hour drive for us to get up here and support the mission. So
wonderful. Thank you for that. So put any questions in the chat. Alex, I'm going to come back to you and ask you. So people don't understand how FEMA works, and I say this to both you and Ms. McShine because I think you all live in a different world, right? Around mobilizing things that you look and you're like, how did this happen? Because when I walk into my gym, I'm like, how did this happen? So I guess we have a couple of questions possibly, but what I will say is, what is the most difficult thing or even the most exciting thing about trying to look at a space, right? And look at a situation and then jump into it. When we said, okay, you're coming to New York, and you came and you saw us, what do you think?
Okay, so I will address that part of the question. FEMA, we're used to work emergencies and disasters nationwide, all type of disasters, earthquakes, floods, hurricanes, tornadoes. So this is a unique mission that we have, but we have the coordination, we have the planning, and we have the teams that can implement this type of mission. Of course, we couldn't have done this without the support and the partnership with DOD. We work regularly in disasters. So the first thing, we needed to understand what was our mission and what were going to be the deliveries. Once we knew all those things, we were able, thanks to George College, to set the stage here at the gymnasium and then all the other areas that we're using for the vaccination. DOD was critical in the implementation of these efforts, and also the state. I have to say from day one, the state representatives have been critical to the success of this operation. So as Commander Ritland indicated earlier, this is a team effort, working together, recognizing who is the SMEs, the subject matter experts in each area, maximizing that knowledge, and then implementing a mission that is to vaccinate the people of Queens. And that's why we have been so kind of successful in this operation. But FEMA, we're used to work emergencies and disaster nationwide, all types of events across the nation.
Thank you so much. So there was a question in the chat, but thank you for emphasizing the subject matter expert piece, because I think that's a really big point. There's a question for Commander Ritland, two of them. Is there overlap between the normal diving work that you do and the work at the vaccination site, which is a sort of a funny question, but hold on. The second question is there a plan to increase capacity at our site or opening another site, which I'm not sure that you all know? Many elderly Queens residents are still having issues getting vaccines. So let's separate that. I'm going to come to Ms. McShine for that second one. And Commander, you can talk about the diving because you're the only person on this call that dives. Unless I missed something in somebody's background.
Yeah, so you're right. To make sense of it, why does a Navy Diving and Salvage Command, why are they in support of this overall mission? And to answer that question, what experience we have is the fact that we have experience with command and control. So command and control of units executing a mission. So that's the experience that we bring to this mission, plus the fact that there's also non-medical positions. So traffic control, we can bring traffic control personnel with us. So it's the command and control aspect that we provide. So we're doing the command and control piece of the medical component that is up here, but then we're also providing the non-medical traffic control, admin processors for people going into the front door as they're getting them into the system. So those positions we can provide. So that's kind of the overlap there in support of this mission, is that we have that experience. We've brought that experience from deploying overseas to standing up something like this. So we've done DISCA missions before. So DISCA, Defense Support of Civil Authorities. And we've done those missions before. I'll be honest, this is the first time that we supported a medical mission. Typically, it's to support a mission that has something to do with the water. But we do have that experience as far as command and control, and that's what we're providing here.
All right, thank you.
I will allow the questions about the number of shots to be passed to Ms. McShine.
Thank you so much, Commander.
Thank you. So I just in terms of the establishment of new sites, so Queens College is one of 38 planned FEMA managed sites across the nation. And the way we decided to establish these sites was to look at social vulnerability across the nation and the size of population. So in New York State, in addition to York and Brooklyn College, we've actually got 4 sites upstate, Yonkers, Rochester, Buffalo, and Albany. And those were all sort of decided upon using this population social vulnerability index to determine where the need was greatest. understanding that we had very limited resources. We were relying heavily on the medical clinical from the Department of Defense. And so we also, the state is also opening up sites. They most recently opened a site in the School of Medicine in CUNY. So they're continuing to do their expansion based on their allocation of vaccines. We have been given specific allocation of vaccines for these federal sites, and we're trying to ensure that we can address underserved populations across the nation. So I think it's really a balance of the state and city sites with the federal sites creating sort of big impact. The sites are usually of 4 types. We've got the type 1, which is 6,000 doses a day. Type 2, like Brooklyn and New York, where we do 3,000 a day. Type 3, where there are 1,000 a day. So we've sort of stratified how we deliver our resources based on the need in the community. So that's a roundabout way to answer the question. And I think for us at FEMA, like Alex said, we are very good at sort of the logistics of managing a disaster, but I think this disaster really emphasized the role of public health and medical in any disaster. I think for a long time, while we had public health at the table, this is the first time that they have actually embedded and sort of worked with us to deliver relief to communities. And I think that has been something that we in FEMA have learned, that every disaster has a public health and medical impact. And we need to work with the subject matter experts to execute on that.
Mm-hmm. Thank you so much for that. I want to also add, thank you all for welcoming our nursing students. We have our nursing chair on the line here. And I just want to say that they have been volunteering regularly. And we've had a few other students to volunteer. And thank you for that, because that is, for them, that's deal-breaking experience that they will never, ever forget. They will never forget. So thank you for the coordination and the collaboration of them being there. Let's see. I believe that we just have comments, not as many questions. We've talked a little bit about logistics. We talked a little bit about numbers. Thank you so much for that breakdown of the collaboration between state, city, all the different entities. What was the biggest challenge you faced in opening the site in this community? I don't know that there was a challenge, but I hope there wasn't one. But was there anything that was out of the ordinary for any of you all? I don't know that there was, but I may just be overly positive. I think we did okay. All right, I think we're good. Let's see, what else do we have here? They're gonna mute everybody so we don't have too much echo. We have a couple of people. Thank you to our foundation board chair. She said that she's received both shots at York and very grateful for that experience. Question, COVID-19 vaccination requires unprecedented logistics. How are vaccines and vaccinations tracked from supply to recipient? Is that an actual question? I'm not sure. Are they tracked in that way, or no? Not from Ms. McShine. You guys need to unmute unmute her so she can talk. There we go.
I think we've been using the state's system of patient tracking to track the administration of doses. And then the federal government has a system called Tiberius, where they track the doses delivered. So we marry the doses administered with the doses delivered through Tiberius and the state's patient system of record.
Okay, thank you for that. We're going to now hear from Professor Renee Wright just a little bit about our nursing students, and then we'll see if there are any other questions. I asked them to help her. There we go. Good morning. They're going to unmute you. Hold on, Renee. It's just so we don't want too much echo. So that's what we've been doing. So get in 1 second. So I will ask that that you also speak about our most recent recognition of our program. I think you should brag a little bit about that. So almost, okay. Now you unmute, you go ahead, unmute yourself. You ready? There we go. Thank you.
Good morning, everyone. Good morning, President Eanes. And thank you to the military and to FEMA. We are very grateful to have the opportunity to participate with the vaccination program. Many of the students, faculty, and staff have been personally affected by the pandemic, and having the opportunity to participate in the vaccination program will hopefully assist the community that was impacted by the pandemic by preventing further loss. The nursing college, the students from the program, they bring their desire to serve the community, and many of them live within the community, work within the community. So it's such a rewarding experience and to be such a part of this great history. So thank you again for welcoming the students. We just had a group there this past Saturday, and it was overwhelmingly fantastic. I think they had more experience on Saturday than they've had with some of the restrictions in the clinical sites. So we're very grateful. And our program has been recognized by RN.org as one of the top nursing programs in New York State. And I can't give credit, it's not my credit to take, but it's the faculty, it's the staff, it's the students, it's Dr. Valerie Taylor Haslip, who was the chair prior to me. So it's all the great leadership and the support from the administration. So we thank you. And I can't forget Dean Becker for all her support. So thank you all. It's greatly appreciated.
Thank you. So let me echo one of the things that we've been trying to work on here. We're one York. So whenever you're with us, we're all together. So we're one York. We work together on everything. We appreciate everyone. And it really is, for them to be able to be in that site as students and have that experience is invaluable. So thank you, thank you, thank you, thank you. We cannot thank you enough for all of that. So I think we're probably in a space where we can wrap up, unless I'm going to ask anybody if you have a parting comment or something you would like to say, just raise your hand or that kind of thing. I thank the Lieutenant Governor for being with us. I want to echo some of her comments about resilience, patience, grace, character, and managing change. She did highlight the fact that we are going to have to be in a position to take our lessons, even though we've had a lot of loss, right? And a lot of hard knocks during this time, but we're going to have to be prepared to take our lessons and then build on that. So thank you. I appreciate her being with us. And I appreciate you all being part of this amazing work that we're trying to do. So what's to come? We have no idea. I think that people will start to ask us shortly, how long will the site at York be a site at York? And I know that that's an ongoing conversation, and we'll be talking about that a lot. I know that we are getting prepared for the fall, and that's going to be important, right? So we have to plan for that. So I think I want to be sure that I go around. Does anybody else have a parting comment or concern or question? Commander.
So I wanted to echo, given the fact that it's Women's History Month, I wanted to echo the Lieutenant Governor's comments about the amazing work that women do. And I just wanted to say this because so a lot of us who have come up here, the vast majority of the folks in the military that came up are men, but you know, a lot of them are women who are doing fantastic work up here. But a lot of us left our wives who are also working, mothers as well, and kids, and really we just kind of dumped it on them to kind of figure things out as we came up here to do this important mission. And really I can't say enough about how amazing women are. And you know, just when she was saying those comments and where we came as a nation and where we have come, you know, to get to, you know, equal pay and treating everybody, you know, equally. And really it's just, you know, when I look back at even, you know, some of the leaders up here, you know, my own family, my wife is a working mother. She's also a commanding officer. She's in charge of, you know, 200 people. And she's got 4 kids that well, we have 4 kids that she's taking care of as well. So really it's just, it's so amazing to me on really how versatile and amazing that women that they can just do it all. And so I can't say enough about the fact that, you know, we're now in Women's History Month. And I just wanted to echo some of those comments that the Lieutenant Governor had mentioned in regards to how amazing women are. So it's just, it's amazing. You know, they don't skip a beat, they don't complain, and they just get it done. And that's what I see all the time. And it's just, I couldn't be more proud of what women are able to do, to be honest with you.
Thank you so much. We appreciate you celebrating with us. We're very grateful. All right, so I think we're very close to our time. You all, this is a recorded program. We are going to share it with the other people who were not able to come. We had about 55, maybe 60 guests in and out at any time. That's fantastic, right? That's good stuff. I'm glad for people sharing the virtual space with us. It's really important. And I hope that you each will stay healthy and safe, but also remember that this is groundbreaking work, and I appreciate everything everybody has done. I don't know that we'll ever forget this. I will tell you, Commander, that I don't walk as fast as many of the officers that you have there. And so what Dana knows is that I get out of the way when they start moving, because they're very swift, they're busy. And the organization has been amazing. The collaboration and partnership has been amazing. And when I see people from our community just thanking us and just feeling so at home at York, to me, that is what we are here to do. That's what we are here to do. So thank you all. Everybody good? Everybody's good? Okay. Okay. Thank you for attending the executive breakfast. Please have a wonderful day and take care. All right. Thank you.